You're watching The Front Row. Thank you for staying with us. We are talking about the World Day for Safety and Health at Work that will be marked on the 28th of next month, but also occupational safety and health at work generally. Why is it important for you and I? Before we go to our guests, two questions, important questions that have been asked here that I think our panelists could try and respond to. Someone called Omar Idi has asked, kindly ask the PS what the ministry is doing in empowering the DOSH officers in ensuring compliance with COVID-19 mitigation measures in workplaces. I hope, Engineer Tum, you've gotten that on what the ministry is doing in empowering DOSH officers to ensure compliance with COVID-19 mitigation measures in the workplace. And Sudi Kevin says, a key health and safety concern directly linked to COVID-19 is mental health. What specific procedures under OSH directly touch on supporting employees' mental health and responding appropriately to mental health issues when they arise, especially for frontline workers? I think you can take this, Dr. Nyandusi, before we go to the PS.
Thank you very much, Akisa. As we had mentioned earlier, these are really unprecedented times. And these are times when critical leadership is supposed to be shown, and solutions towards forward movement on the issues that have been raised are evident. The COVID-19 crisis, like I said before, what it has done is that it has revealed the weak underbelly of the OSH system that we have in the country. And therein also lies the opportunity for us to build back better. On the issue of mental health has become a big challenge in the workplace. It has been a big challenge before. We know that the issues of anxiety in the workplace, depression in the workplace, stress in the workplace with the timelines and targets and performance appraisals have been there in most workplaces today, where every employer needs to get value out of every worker that he has put in place. So the issues of stress, anxiety, depression have been there in the workplace. What COVID-19 has done, it has accentuated it and actually created an obvious need for us to begin addressing it, both in the workplace and even at home. We've noticed also that a significant amount of working from home has also led to increase in the intimate partner violence has actually increased in this time during this pandemic, which has been attributed variously to the issues of loss of income, anxieties about jobs, layoffs, as well as the increased presence between partners at home, which obviously now creates an explosive setting in which we are seeing ourselves, the intimate partner violence, as well as at the extreme cases where we do have increase in homicides. The International Labour Organization, in its wisdom, in 2010, actually included mental illness as a listed and scheduled occupational disease. What does that then mean? That then means that every enterprise requires in its assessment, in its holistic assessment of its OSH preparedness, to also include mental state, mental health in the status of the assessment, and be able to also include interventions that are geared towards ensuring the continued mental health of the workers. So this is really the direction that we are moving. Like I said, building back better, also the inclusion of mental health. It's been there, but what COVID-19 has done is that it has actually accentuated it to make us much more conscious. And when you're building back better, to actually include the same.
That's an important conversation. Ms. Mugo, back to you, and perhaps you will speak on mental health and especially this trying times that we are all living in. But are there any gaps that the Directorate of Occupational Safety and Health Services should address from where you sit?
Yes, there are. There are a number of gaps. We do recognize that the Directorate has done a lot in the last 1 year, But there's a disconnect between what is written in policies, what is written in law, and what is happening on the ground. There is certainly a lot more that could be done between the directorate and employers on the ground to build the capacity, to raise awareness, and to enhance some of the new trends that Dr. Nyandusi is talking about, because mental health, psychosocial issues are a huge challenge right now. And you need to change the narrative about mental health. We need to change the narrative on occupational health and safety issues and recognize as a country that employers do value the health and safety of their employees, and it is something we should work on together. We should make it possible for compliance to happen at the same time as building responsibility. I think we should not over-focus on finding out what is wrong, but building the capacity for compliance, because that is the way forward. There is no way, even if the ministry were to hire all the people to fill all the vacancies, which are many, as Ernest Nadome was talking about, but at the end of the day, it still comes back to me, making us aware, as Kenyans, of the responsibility we bear for our own health and safety. So as employers, we'd like to work more with DOSH. They're doing a good job, but there's a lot of room for improvement in that. And then I think as a country, we need to look at the workplace as a very strong place to build this capacity, because people outside the current rigors and the restrictions that COVID has brought spend 8 to 10 hours of their working day at work, 5 days a week, in some cases 5.5 days. So that gives you a very ready platform for addressing the aspirations of the international labor standards and all the laws that are in place, so that we can help the people who are in employment to then be able to transfer some of this culture back to the community. Because it is true that COVID-19 has really exposed the fake lives I think we as Kenyans were living, the work-life balance, the value for the family, the listening and the tolerance. Because why is it that things have just blown up? Because of COVID. There must have been a problem already brewing, but of course we're also aware that a lot of pressure have been brought about by the fact that people have lost jobs, people have lost loved ones, people have been sick. So how do we deal with all this pain and all this anger that Kenyans have? We need to put in place an avenue for redress and for Kenyans to be able to get treatment without getting stigmatized, so that mental health, which internationally, yes, has been recognized as an occupational disease, begins to be looked at just as one of the illnesses that somebody could have, so that we make it possible for people to come forward and for people to seek help. And as employers, we're already doing a lot to help address this amongst the employees, because as people continue to stay home for longer, they are continuing to manifest signs of stress and distress, and it is very important that we address them. So the gaps that there are there in terms of legislation and the practice, and ultimately the culture of health and safety. A lot of room, therefore, for building back better, for building back stronger, and building back together, as Dr. Nyandusi is saying.
Great. Let's get the comments from Mr. Nadome there. And the PS mentioned something very critical, that the establishment of the occupational disease funds. I'm really interested to hear what the union thinks about this.
Thank you, Akisa. If you ask me about that fund, it should have been there a long time ago. This has been a major gap immediately after the enactment of this particular Occupational and Safety Health Act. I'm saying that because there's been a big problem, because here we are talking about, and I think we need to differentiate the two, and this has come out clearly from Madam Jacqueline Mugo, that we need to distinguish rather between COVID-19 and the occupational diseases. And I'm happy that, as rightly put by Nyandusi, and I'm happy that Jacqueline and my boss, Francis, are members of the governing body who participated in enlisting or including stress disorder, mental issues as also part of occupational disease. So what does it mean? With the occupational disease in place, what is the challenge? The biggest problem has been the fund. So To us, I think we fully support that, the fund should be there. We are ready to participate in all the meetings, I mean the engagements that the ministry will invite us. But first and foremost, I think, which I need to allay fears also from maybe workers. You know, the moment you mention a fund, what rings in one's mind is maybe the employees will contribute, employers will contribute and all that. But I think for the issue of occupational disease, this is purely, as much as it calls for both parties to ensure that on matter safety and health, we are one. But when it comes to occupational diseases, this is an obligation of the employer. And we are obviously expecting that once this fund is up and running, then the employers and the biggest employer in this country, the government, should have this fund up and running. I think we are in support of it. The only thing that may be going forward also is the issues of the governance issues, but this particular fund, how is it going to, how will it be managed and all that. But I think the long and the short of it, once you have this fund up and running, issues of a workplace, it brings in industrial harmony. When an employee knows that if an occupational disease, and the employee is out there ready to attend and make sure that the employee is treated, I think that really gives motivation. And at the end of
fair enough, Mr. Nadome, fair enough. Not too much time left, so my apologies, I have to cut you short because I need the PS to respond to this question so that we can start our round of closing remarks. There's a question on what the ministry is doing to empower DOSH officers and officers in ensuring compliance with COVID-19 mitigation measures in the workplace. Talk to us about that.
Thank you, Wandera. You know, when I look at it from the point of view of the silver lining that this pandemic brought with it, is that it gave us that, framework to engage as a government with the tripartite partners. And in that engagement, I think very many things have been put in place to ensure that we are working together. Both all the parties, that is the employers and the employees, are listening to one another and having discussion, and that is why we put in place the MOU that was gazetted sometimes last year. And even going forward, as we speak about the fund that we are now thinking of creating, that is the silver lining, Akisa, that we are talking about. Now we are able to sit down and ask ourselves, as a country, within and for us to ensure that our workplaces are safe, number one, and number two, that the welfare of the workers is taken into consideration. What must we do? So now, empowerment. Have we empowered OSH to ensure that they put in place, to enforce the mitigation measures that we put in place in the workplaces? The answer is yes. And how have we done this? Like I said earlier, we've had to employ more staff. We have had to train them. We've had to have discussions with the employers and the employees to ensure that they understand what their roles, individual roles are.
Right.
And even as we speak now, that is why they are able to themselves sensitize the workers in the workplaces as they continue working.
All right. I want us to start with the closing remarks. Let's start with you, because I'd likely not come back in under 1 minute.
Thank you. Thank you very much, Akisa. What I want to say as we wrap up this discussion is that as a ministry, we are very, very happy. Mm-hmm. We are happy that we are able to sit and discuss issues to do with the workplaces. And we are able to discuss those areas that we've not, as a country, focused on. For example, the issue of the ILO regulations that were brought in when when the pandemic visited us last year. Remember, what we did in our MOU that we signed was to ensure that we domesticate all those regulations that ILO had come up with. Okay. And Wandera, you realize that the focus was particularly on the workers. And I want to agree with Madam Mugo when she says that we need as a government also not to focus only on the formal employees, but also the informal ones.
Thank you.
And the silver lining I'm talking about is that it has made us as a government to focus on the employees that are on the informal enterprises.
Thank you, Bonapi. Yes, not too much time, my apologies, because I want Dr. Nyandusi to also give us his closing remarks on the occupational fund. What do we expect to see even as we go forward?
Thank you, Akisa. I think let's put the issue of the Occupational Diseases Fund in the proper perspective. Up to 2007, we had an act called the Workman Compensation Act. It defined a workman, and not everybody who would get injured or get a disease in the course of his work would be compensated. WIBA was progressive in the sense that it recognized every worker, and the fact that you can get a disabling disease or an injury in the course of your work and therefore is compensable. However, it has one big limitation. One of the biggest limitations that the Work Injury Benefits Act has is that it's what you can call a blame-based legislation. You cost it, you pay it. So I am an employer. If a worker gets injured or gets a disability, I am blamed and therefore I pay. And what we notice in the course of our administration of WIBA, nobody likes being blamed. And therefore, what happens is that there is all these attempts to make sure it was not you, and what happens is that a lot of the claims go unpaid.
Right.
What we are saying is that we need to adopt to the global best practice.
Thank you.
The global best practice is to have a fund out of which in the setting there is today is that the employer is still paying, but he's still paying when he's being blamed for causing it.
Right.
If we had a setting where we have a fund out of which is properly managed, properly with proper governance structures, you would have to qualify the presence of an occupational disability, which thereafter is payable from the fund.
Thank you. Thank you.
Just one other thing. When we talk about the Occupational Disease Fund, in a time when we are talking about coronavirus, I think in a lot of people's ears, it sounds like this is a coronavirus fund, which I think is not the truth.
Okay.
There are over 40 diseases which are defined in legislation today as occupational diseases, and the mechanism of payment for workers who get disability from these occupational diseases is not there.
Okay, great. Let me give them 30 seconds each, Ms. Mugo and Nadome. I'll start with you, Ms. Mugo. Closing remarks as we wrap up.
My closing remarks, occupational health and safety remains a very important aspect of our recovery as a country from not just COVID-19, but also to get back to the growth trajectory that we're on. It should not be seen as a short-term measure. I fully agree that the funding occupational health and safety should not just be confined to COVID-19, but the OSH fund that we are talking about should not be imposed as a tax on employers, because that would not be something that employers would welcome. It is a responsibility of us as a nation. The bulk of the workers are either in the informal economy or in government, so we should think of a way that is sustainable without increasing the cost of what employers are already bearing under the insurance covers that we have to look after our employees.
Great.
It is an important issue. Employers are willing to remain engaged, but it should not be a tax that is imposed on employers.
Mr. Nadome, have the last word on this as we wrap up.
Thank you, Akisa. The Occupational Safety and Health Act is the best that we've ever gotten as workers. And what my appeal, special appeal, is to the ministry and social partners, the social partner employers, is let's work hand in hand. We started very well. Let's move together. Let's roll out this. Let us build capacity. Let's sensitize employers. Let's sensitize workers the importance of this. And over and above all that, in the legislation that we are part and parcel of, this can only happen if the Directorate of Occupational Safety and Health is converted as an authority. It will have the teeth, it will have the muscle really to make sure that this particular act is adhered to the letter. So it's critical that, and this is an appeal to the government, that let this particular directorate be converted from a Ministry of Labour department to a
We are out of time. Thank you very much. My apologies for cutting you short. We are out of time, completely out of time. Thank you for joining us. Engineer Peter Toom is a PS Labour. Dr. Musa Nyandusi, Secretary Occupational Safety and Health Services of the Directorate of Occupational Safety and Health Services. Anas Nadome is the First Assistant Secretary General, KOTU Kenya. And finally, Ms. Jacqueline Mugo is the Executive Director, FKE. Gentlemen and lady, thank you for joining us. I am Akisa Wandera. I'll see you next time on The Front Row.